Well, good afternoon, students. This is NURS 323 Nursing Research online. I am Dr. Pauline Green, and we will be discussing Chapter 1 today. Introduction to Nursing Research and Evidence-Based Practice. These PowerPoints come from your textbook, Understanding Nursing Research by Grove, Gray, and Burns. These are the learning objectives for this chapter. You should look at these, and as you're reading and you go back in preparation for your first quiz, look at these learning objectives and see that you're able to respond to them appropriately. So what is nursing research? Students in this class are in the RN BSN track. You have your nursing license. You are attempting to get your Bachelor's of Science in Nursing. One of the distinguishing characteristics of the BSN graduate is that they can utilize nursing research to improve practice. So, nursing research. Let's just take the word research. Research means means again, and search means to look at, right? Or search. So you are searching again. You're looking back and trying to figure out the answer to a problem, trying to improve practice. You examine carefully. Diligent systematic inquiry, discovery. The goal is to develop an empirical body of knowledge for the nursing discipline. This process is built on the scientific process, and in science you make observations from reality. You develop some hunches as to what's going on. You call those hypotheses. You test your hypothesis, and then you draw conclusions from your findings. So all professional disciplines have a unique body of knowledge based on research. So nursing research is the systematic, scientific, rigorous process that investigates questions about nursing phenomena, and they're trying to validate and refine existing knowledge base. There are two types of research in nursing that are used: quantitative research and qualitative research, and we'll be talking about that in quite a bit of detail in Chapter 2 and Chapter 3. Evidence-based practice. Since you've been out in practice, you have heard EBP, or evidence-based practice, that term used quite a lot. You may be on the Nursing Research Committee or the Evidence-Based Practice Committee, or whatever your agency calls it. So evidence-based practice is the collection, interpretation, and integration of valid research evidence combined with clinical expertise and an understanding of the patient and the family. This diagram is very useful for understanding evidence-based practice. So the three circles here, they're interacting circles, so one influences the other, right? These are the elements of evidence-based practice. The best research evidence comes from synthesizing the findings of multiple quality studies to address a practice problem. So the elements of evidence-based practice are the best research evidence, clinical expertise, and patient needs and values. All of this goes into making evidence-based practice. An example of synthesized research findings on hypertension or patient fall risk or ventilator-associated pneumonia. We have evidence practice-based guidelines for these. Why is research important for evidence-based practice? It develops empirical knowledge base, identifies best practices that are based on clinical practices, and it improves outcomes for the patient and family, nursing care, and the healthcare delivery system. Nurses need research findings to determine the best way to deliver care, and this in turn will improve quality care in the healthcare system overall. You are probably familiar with evidence-based practice guidelines, and you need to be knowledgeable about how to appraise and synthesize research findings, to critique them, so that they can be applied in practice appropriately. So what role does research have in implementing an evidence-based nursing practice? We can describe a problem, identify and understand the nature of a phenomena, and sometimes relationships among phenomena. We can explain. This really further clarifies relationships among variables, the reason why certain events occur. For example, determining the relationship among health risks, health behaviors, and health status. Third, prediction. Prediction involves estimating the probability of a specific outcome in a given situation. An example is a quantitative study of factors perceived by critical care nurses to predict musculoskeletal injury from work. And control involves manipulating the situation to produce a desired outcome. See evidence-based practice guidelines for best practice for IM injection. Identifying and understanding the nature of nursing phenomena and the relationships among the phenomena are examples of what? Description, explanation, prediction, control. Now, you need to answer that question and confirm that you have the right answer. What is the history of nursing research? Well, history of nursing research goes back to the 1800s. Florence Nightingale, the founder of modern nursing, she was a very respected nurse. She had gotten her training in France and Germany, and when it was time of the time of the Crimean War, they were losing a lot of military soldiers from infection, and she was asked to go there. And what she was able to do was demonstrate through statistics. She was quite a statistician. She demonstrated the incidence of infection in the Crimean War, and then she was able to document how procedures involving sanitation, clean air, clean water, were able to produce a dramatic drop in infection rate and mortality. Clinical research is the current major focus of nursing research and will continue to do so. Into the 1930s and 40s, the research was mainly on nursing education. In the 1950s and 60s, a lot of studies on nursing roles and work satisfaction. And then in the 1970s and thereon, there was increasing emphasis on clinical research, patient problem research. So I'm going to ask you to see Table 1-2. Some important publications. In 2000, we had the publication of Healthy People 2010, and then later on, Healthy People 2020. In going back to 1985, we had the National Center for Nursing Research, and Ada Sue Henshaw, who was the first director, was responsible for trying to improve the status of nursing research within the profession and outside, and increasing its funding source. We can't carry out research without money to conduct the research. And she was responsible for the National Center for Nursing Research becoming the NINR, the National Institute for Nursing Research. So it's part of NIH. It's an actual institute. Other important things were publication of this journal, Biological Research for Nursing. The Joint Commission revised policies to support evidence-based care. There's another publication, Worldviews on Evidence-Based Nursing. And we've already talked about Healthy People 2020. Here are some websites for you to investigate. The Agency for Healthcare Research and Quality, Guidelines and Priorities. That was founded in originally around in 1989, I believe. So they issue the practice guidelines, and they started out with just a few, about a dozen. One of the first practice guidelines had to do with decubitus ulcers. Now there are over 300 guidelines. You can go to the NINR priorities at that website. And AACN, they revised their, AACN is the American Association for Colleges of Nursing. AACN is responsible for accrediting baccalaureate nursing programs, master's programs, doctoral programs in nursing. And in fact, AACN was here about a year and a half ago and approved our program, full accreditation. So in 2006, AACN made a statement about the future direction of nursing. They wanted to create a research culture in the profession, and they wanted to provide nursing education programs, quality programs, in order to provide a cadre of future nurse researchers. How is nursing knowledge acquired? These are the various ways, and you can look up the definitions for each of these. Let's see. Let's see. Sorry to keep you waiting here. So tradition, right? It's always been done this way. Let's continue doing it. Authority, someone with some expertise says it should be done this way, and everyone does it. Borrowing from other disciplines. This is done quite a bit. Earlier, it was done without trying to understand it in terms of a nursing framework. So some of it, the application was a little bit awkward. Trial and error. Try something. If it works, keep doing it. If it doesn't work, don't do that. Change it. The problem is that there's no documentation, and there's no research supporting it. Personal experience. I've had so many patients with this condition, and this works for me. Role modeling. You probably are familiar with a novice, a student or a novice, finding a nurse or a teacher or a parent for whom they consider that person to have very good qualities, very good behaviors, and they model the example of the expert person. So a lot of new grads are given a mentor during their orientation, and that helps quite a lot, especially if it's a good role model. Intuition. Well, that's insight into or understanding of a situation or event as a whole that usually cannot be explained logically. Okay, so the example is someone who has many years of practice. An inexperienced nurse and an experienced nurse go in to a patient's room. The new nurse doesn't pick up on signs and symptoms that indicate that the patient is deteriorating, and the experienced nurse quickly, without thinking, quickly recognizes through intuition that this patient is in trouble and can act to assist that patient. Reasoning. Processing and organizing of ideas to reach conclusions, right? So we use deductive and inductive reasoning. Have you heard of the Quality and Safety Education for Nurses campaign, QSEN? This is an initiative that focused on the developing requisite knowledge, skills, and attitude statements for each of the competencies for pre-licensure and graduate education. The website is www.qsen.org, and they have their competencies for both RNs and pre-licensure nurses. Our curriculum includes competencies, QSEN competencies, in all of our courses. And it's an attempt to integrate best current evidence with clinical expertise and patient family preferences and values for the delivery of optimal care. How and why do researchers utilize empirical knowledge? Empirical knowledge, that is something that can be gained from our experience, right, is gained by employing different methods of research. Quantitative research is one approach, qualitative research is another, and outcomes research is another. So quantitative research and qualitative research are the two major approaches used in nursing research. Both are important and both are needed, but there are differences. So I'm going to ask you to see table 1-3 for the differences. It's very interesting. Table 1-3 deals with characteristics of quantitative and qualitative research. So they differ in their philosophical origin, focus, reasoning, basis of knowing, theoretical focus, and researcher involvement. So in quantitative research, quantity, right, it usually involves numbers, right? Whereas qualitative research involves generally themes that come from interviewing patients or families. The focus in quantitative research is very objective and very concise. Qualitative research is broad, it's subjective, it's from the point of view of the interviewee. Quantitative research uses logistic, deductive reasoning, and qualitative research uses dialectic, inductive reasoning. Dialectic means going from theory to practice, from practice to theory, and back. Basis of knowing. Quantitative research is interested in cause and effect relationships. Qualitative research is interested in meaning, discovery, and understanding. The focus of quantitative research is to conduct and test theory. They want to describe variables, they want to examine relationships, and determine cause and effect interactions. Whereas with qualitative research, this is conducted to promote an understanding of the human experience and develop theories to describe the experience. You probably have more experience reading quantitative research than qualitative research. So a lot of research around quantitative research would be the knowledge, skills, and attitudes of premenopausal women towards mammography. Okay, and they'll come up with numbers, and then they will have various variables, and they will investigate the relationship of the variables. In qualitative research, they're not doing that at all. They interview a set number of patients with a particular condition. So an example would be the lived experience of young adults with multiple sclerosis. Okay, so they interview them, they tape record them, they type up the discussion, and then they analyze the results, looking for themes that become apparent in the discussion. Here's a question for you. The beginning nurse researcher would like to investigate credible resources for implementing protocols in clinical practice. Which of the following would be considered empirical sources of nursing knowledge? Reasoning, authority, and tradition, quantitative, qualitative, and outcomes research, care maps and protocol, role modeling, and trial and error. Okay, so empirical, right? It can be verified. Okay, so I would say you're talking about B, quantitative, qualitative, and outcomes research. What are the categories of quantitative research? Descriptive, correlational, quasi-experimental, and experimental. So in descriptive, their focus is on describing variables. In correlational, we're looking at relationships among the variables. In quasi-experimental approach, we are determining the cause and effect relationships among variables. And experimental, this category of research uses a control group, uses the aspect of control in the form of a control group in an experiment. So an example would be testing two different approaches to teaching drug therapy adherence for diabetics, or drug therapy adherence for HIV patients. Quantitative research characteristics. We went over this when we talked about the differences between the two. So the A philosophical origin is logical positivism. The focus is concise, objective, reductionistic. The reasoning is deductive. The basis of knowing, they want to know cause and effect relationships, and the theoretical focus is to test theory. What are some of the categories of qualitative research? This will be an entire chapter, chapter 3, so we're just going to briefly talk about these. Phenomenological, grounded theory, ethnographic, exploratory, descriptive, and historical research. These are all considered subcategories of qualitative research. Characteristics, the philosophical origin for qualitative research. It's what they call naturalistic, interpretive, humanistic. The focus is broad, subjective, holistic. Remember, it's from the patient's point of view. The reasoning is inductive, right? They go from what they find in the interviews up to theory, rather than from theory down to the specific phenomena. The basis of knowing is, well, they're trying to find out the meaning of illness to a particular set of patients. They're trying to discover what's going on in their lives and understanding. And they're trying to develop a theory from that. Now, outcomes research. Outcomes research, the focus is on patients and families, providers, healthcare systems, practice changes, and policy development. They're trying to determine the effectiveness of nursing interventions in predicting and controlling the outcomes desired for patients and families. Very interested in quality and effectiveness. So they want to know the results of care and the influence of a particular type of care on changes in patient care status. Patient responses to nursing and medical interventions, functional maintenance or improvement of physical, mental, and social functioning for the patient, financial outcomes achieved in the provision of services. For example, if they implement one protocol, does it actually save money or does it cost more money to do this? Patient satisfaction with health outcomes, care received, and health providers. From that information, they can make practice changes, and they can also help develop policy that will state what the desired approach should be. This is table 1.3, characteristics of the quantitative and qualitative research methods. We've gone over this now. I think you're very familiar, but this is important. I'll let you look at this. The nurse researcher is investigating outcomes research on nursing interventions. Which of the following examples would constitute outcomes research? Patient responses to a nursing intervention. Okay, so B would be the answer. How do nurses integrate evidence into practice? Well, it's an attitude, isn't it? It's an attitude of trying to improve patient care and provide quality care. We can integrate evidence by reading and critiquing studies on a selected topic or practice problem. I have a belief that each of you is practicing in a particular area. Okay, so have you started looking at the literature for that patient population? whether it's critical care, pediatrics, maternity, community, psych. Okay? And nursing can participate in the development of evidence-based practice guidelines. An example is the safe administration of IM injections. You read the study, summarize the findings, and draw conclusions about what is known or not known about the topic. Why utilize evidence-based practice guidelines? Well, they help provide high-quality, cost-effective healthcare, and they allow for a synthesis of knowledge needed for interventions in practice. Look at guidelines, look at standards, look at protocols, look at policies. Okay, this table here is a table that shows a hierarchy of evidence going from weakest or lowest level of evidence to the strongest or highest level of evidence. And this is used in quantitative research. Okay? So starting with the lowest, right, opinions of respected authorities based on clinical evidence reports of expert committees. Next level would be a single qualitative or descriptive study, a single correlational study. Going up the ladder here, qualitative research, meta-synthesis and meta-summaries. Integrative reviews of correlational and descriptive studies. Higher than that would be meta-analysis of correlational studies. The next highest level, you notice the color is changing here. It's getting darker, right? A single quasi-experimental study. A single experimental study, referred to as an RCT. R is randomized, C is control, and T is trial. So an RCT, right, is higher than a single quasi-experimental study. Next level would be integrating the reviews of experimental, RCT, and quasi-experimental studies. The next highest level would be a meta-analysis of experimental and quasi-experimental studies. And the highest level is a systematic review of experimental studies, well-designed, randomized controlled trials. So if I asked you what is the highest level of evidence to support practice, would be systematic reviews of experimental studies, well-designed controlled studies. What is the primary role of the entry-level nursing researcher? This is figure 1-4, and the entry-level nursing researcher, okay, identifies research problems, assists with data collection, critiques research studies, and summarizes research findings for use in practice. As a new nursing researcher, you would like to learn more about the research process and identify credible resources. You decide to examine the problem of medication adherence and the use of a medication reconciliation process for patients who are newly diagnosed with hypertension. Have you heard of the PICO? P-I-C-O. Okay, identify the research population, P. I is intervention, C is comparison, and D is desired outcome. In this case, the P would be a patient with hypertension, I would be implementing medication teaching, C would be to compare patient outcomes for the patient who received teaching to those who, for a patient who does not, and O, increased outcome, increased adherence leads to a decrease in blood pressure. Okay, That's a PICO question. What resources might assist you in finding practice guidelines and more information on best practice? Okay, I want you to answer that, okay? Because we've talked about some important resources for you. Okay. What do you think? You think AHRQ would be good? I think so. What about the National Guideline Clearinghouse? That's www.guideline.gov. And also the Cochrane Collaboration in the Library in the United Kingdom. It's http Cochrane, COCHRANE.org. And they have a collection of evidence-based research, and they classify it whether it's low, medium, or high. And you can go to the Stokes Library, research library here at Howard, and look at the databases and see, pull up the Cochrane reviews and start looking at the evidence-based research. That's a good activity for you. Another resource might be your professional associations, like Oncology Nursing Society, critical care nurses, pediatric nurses, post-anesthesia nurses, operating room nurses. Okay, they all have professional organizations, and they most likely have practice guidelines. You were able to find a few practice guidelines for medication adherence. However, you're having trouble finding guidelines specific to hypertension. What would you do? Think about that. How would you start searching for guidelines for hypertension? Your research led you to a tool that's used by many facilities when patients are admitted to the hospital. How can you determine if this tool has evidence to support the use in your practice, right? Well, you would need to look at published research, regarding that tool, and look for what type of study it is. And you're going to be learning how to critique studies, and actually you'll be doing two for this course. You completed your search of evidence and found several randomized control studies, 2 meta-analysis reports, and several expert opinions. How would you rate the evidence? How would you rate the level of evidence that you found? Okay, go back to that chart on the hierarchy of evidence. All right, thank you very much. This is the end.